Hi, I'm Dr. Stephen Conti, and today you're watching this video because you or someone you know probably has bunions, right? Well, don't worry, you're not alone. Up to 30% of American adults have a bunion. Bunions are not an extra bone or growth, but more like a dislocated kneecap or shoulder. In Latin, bunion actually means turnip, which refers to the prominence people see on their big toe. That turnip is actually the misalignment of the great toe joint. The joint dislocates and shifts out of place, creating the deformity. One of the reasons for having bunions is genetics. We call these congenital bunions. It's simply a disorder passed down from generation to you. But it only accounts for about 10% of all bunion cases. The main reason why you get bunions is through an outside force like fashion women's heels. These are called acquired bunions. These shoes might look stylish, but look how cramped the feet are and how the big toe is smushed into the other toes. That's painful. A healthy big toe manages twice the weight of any other toe. When you have a bunion, it starts to angle your big toe out of place, causing it to become unstable. The big toe starts to intrude on the second toe, shifting it out of position as well. Now the big toe can't carry its share of the weight. It has to pass its workload to the next toe that isn't strong enough to handle it. Let's look at what's actually happening in your foot. For years, people thought that bunions were a simple bump. Then they realized that the metatarsal bones were actually out of place by taking two-dimensional x-rays. This was a great discovery, but doctors were still not getting the full picture because they weren't seeing all the necessary angles with those plain x-rays. Through three-dimensional technology, my team discovered that not only are these bones horizontally misaligned, but they were shifting vertically and rotating outward. That's a huge contributor to the deformity and discomfort of a bunion. The only way to see all these misalignments is by doing two additional x-ray views and possibly a CT scan to get a 3D view of what's really going on. But here's the crazy thing. This new imaging we pioneered revealed that the sesamoid bones that sit under the first metatarsal were people's main source of pain and discomfort. As the big toe shifted out of place, these tiny bones became misaligned from their grooves. This misalignment causes arthritis, which is the erosion of your cartilage. The cartilage between the metatarsal and sesamoid bones act like a protective padding, so they don't grind together. It's like a comfy orthopedic chair for your feet. Arthritis is an incurable disease, and once that cartilage is gone, it's gone. Like an uncomfortable seat that has no cushioning. That's why early intervention is so important. So you're probably thinking, Dr. Conti, this is the most entertaining video about bunions I've ever seen. But what can be done to help my bunion? The most important step to take care of your feet is to see an orthopedic surgeon who is a foot and ankle specialist. If you had a bump like a bunion anywhere else in your body, you'd go running to a doctor whether it hurt or not. You should treat a bunion the same way because early intervention is the only way to save the cartilage in your feet. Remember that once that cartilage is gone, it's gone.
In this report, we are going to cover 5 of the top bunion remedies that flat out don't work.
Myth number 1, herbs. Great for tea and cooking, but can't correct the structural issue. Myth number 2, anti-inflammatory medicine. Helps with the pain, but it won't solve your problem. Myth number 3, splints. Temporary, inaccurate, never aligns anything. Myth number 4, bigger shoes. Makes about as much sense as wearing bigger pants for a dislocated kneecap. Myth number 5, toe exercises. Why the hell would you put more strain on a dislocated, unstable foot? If your bunion is already at a stage where you're experiencing any consistent discomfort, surgery will probably be the best solution. The surgery that I perform corrects all of your bunion issues. We realign the metatarsal bones horizontally, we reposition the bones vertically, correct any rotation, and move the little sesamoid bones into their proper position under the metatarsal bone. So just to recap, we realign your metatarsal bone horizontally, vertically, and rotationally, and get those sesamoid bones back in their grooves. where a lot of other doctors are still only correcting the horizontal issue. All of this is secured by using any combination of plates and screws. Then it's about letting the correction properly heal in post-op. Welcome to post-op. Not too long ago, bunion surgery was a notoriously painful operation to recover from. But luckily for you, we are in a new era of bunions. A better understanding of bunions, improvement in surgical techniques, and more appropriate pain management have made it way more comfortable to heal from surgery, if you follow two important guidelines. 1. Keep up with your pain management. Before the surgery, you'll be offered a nerve block which will numb you from the knee down and last between 1 and 3 days. If you take your at-home pain medication on day 1, you'll stay ahead of the pain and have a much easier recovery. Don't let that nerve block lull you into a false sense of security. The nerve block is not a substitute for pain medication. In the race with pain, be the tortoise, not the hare. And 2, keep your swelling down. Any surgery of the lower extremities will have swelling because gravity likes to push blood into your legs. Swelling, however, slows the recovery process and doesn't let blood circulate as easily. It's important to keep your leg elevated above your heart as directed by your surgeon. A good rule of thumb is to raise your foot higher than your shoulders. Take a look at this. Pretend that this is your heart and this is your foot. Swelling, no swelling. Heart above foot, foot above heart. Make sense? After a few days, you typically should be able to put weight on your heel with crutches. After 4 to 8 weeks, you may put weight on your whole foot without crutches. Around 3 to 4 months, you can return to most of your daily activities, and by a year, you should be maximally recovered. So now that you understand a little more about what a bunion is and how to take care of it, all that's left for you to do is to call the best orthopedic bunion specialist you can find. I want to cut back in to drive home 3 main points. First, find an orthopedic surgeon who specializes in bunions and ask them why your bunion hurts. You want to hear the word sesamoid. Second, if you're going to receive surgery, ask what's the goal of surgery. Remember, the goal should be to realign your sesamoid bones. Lastly, ask the surgeon to describe how they're going to correct your bunion. You want to be sure that the process will put the sesamoids in place and that it corrects every misalignment. Don't be taken in by fads of promises of small incisions or immediate full weight bearing. Your bunion should be treated in a way that makes sense to you based on the newest information we've presented in this video, and that's why I made this video for you.